Hello, my name is Kyle Gilbert, and this is the simulation teaching method. So according to the textbook, simulation can be defined as a trial and error method where artificial or hypothetical experience is created that engages the learner in an activity that reflects real-life conditions, but without the risk-taking consequences of an actual situation. Some of the major components of simulation are it allows the learners to make decisions in a safe and controlled environment. It allows them to witness consequences and evaluate the effectiveness of actions. It should always be followed by a debriefing session, and it should resemble real life as much as possible. Simulation looks at the cognitive domain in a couple ways. It's used during debriefing sessions to show what was learned and what can be changed, and when those performing the simulation can apply their knowledge to the situation. The affective domain is shown when those performing the simulation have to respond to a change in the scenario, and by the ability of the learners to accept and value others' input for changes during the simulation, such as a debriefing discussion. The psychomotor domain is where simulation really shines. It allows learners to physically perform skills in a controlled environment, and learners are able to show sensory awareness to cues during simulation, such as changes in vital signs of their patient's condition. Some of the benefits to simulation are it's an excellent psychomotor skill development. It enhances high-level problem solving and interactive abilities in the cognitive and affective domains. It provides for active learner involvement in a real-life situation with consequences determined by variables inherent in the situation, and it guarantees a safe, non-threatening environment for learning. The major con to simulation in healthcare is its cost. It can be very expensive, and to operate all the equipment it can be very labor intensive, and because of the cost it's not readily available to all learners yet. One example of simulation in healthcare teaching is a mock code or a mock cardiac arrest. It is a highly practiced simulation in the healthcare setting. It allows for an experienced nurse to stand by and provide instant feedback to a novice nurse or a group of novice nurses running the code. Another example of simulation in healthcare education is utilizing a whole-body patient simulator, sometimes known as SimMan, to train healthcare professionals in a multitude of psychomotor skills. It allows for nursing students to practice assessments and drug administrations with the ability to make mistakes and learn from them in a controlled setting. Another example of simulation in healthcare education is a simulation for nursing students to practice critical thinking skills, leadership, communication, and teamwork. They're allowed to communicate results with other team members, such as a provider, and it allows them to delegate tasks to other team members so that way they can organize and prioritize their other tasks.